Senator, we just heard from the USTR rep, and he said that the Nafta negotiation talks are going to start in mid-August. What are you going to be listening for in terms of the administration's renegotiations on Nafta?
We want to make sure that our agricultural products continue to have market access, that there's not retaliation against our ag products because Mexicans are concerned about some other issue. Similarly, there's been some lack of enforcement of some things. The question I raised is that under NAFTA currently, there is a 25% domestic content law on things like steel for pipelines. But apparently the Mexicans, I'm told, have increased that to 50%, and we've not enforced that. So to what degree are we going to want to address should there be domestic content laws? And secondly, how are we going to enforce that whatever those laws are, it's not exceeded?
Should currency manipulation provisions be included in the NAFTA renegotiations?
Yeah, well, of course, currency manipulation is in the eye of the beholder. I think it's wise to look at that, but it is a tough issue to completely define.
Senator, you've been one of the leading lawmakers on the health care overhaul debate here in the Senate. We're hearing that it's going to be released, at least some outline of it tonight or tomorrow morning, with the Senate Majority Leader saying he wants a vote on this by end of next week. Is he rushing it?
It depends on how extensive this is. This is not redoing 1/6 of the economy. We are not touching Medicare. We are not touching employer-sponsored insurance. So it's the narrow focus of the individual market, which is about 4% of the insured, and the Medicaid market. I'll just stop there. So it depends on how extensive it is. I'll know that once I see it.
Are you frustrated at all about how this is, about the process of this? And are you worried at all about disappointing folks or even heading into midterms that there could be a referendum vote heading into midterms as a result of how quickly this has moved?
As a general rule, good policy is good politics. So if what we come out with is good policy, I'm comfortable with the politics. As a physician, I want to make sure that we actually take care of patients, lowering premiums but making sure they have credible coverage. I don't particularly care for the process, but as opposed to sitting on my hands and complaining about it, I'm just diving in trying to make the final product better.